X-linked agammaglobulinemia blocks the maturing of B cells, and B cells are cells that produce antibodies. This means that it is a severe hindrance on the patient's immune system, and the resulting antibody count is so low that XLA patients are known to contract over 20 times the amount of infections and diseases contracted by an average individual. Although many of these contracted infections are not too serious, like the flu or pneumonia, XLA often causes diseases that lead to death. Ted here was born with X-linked agammaglobulinemia. He's always been very sick. He was very sick as a child, particularly with respiratory infections, despite his parents' efforts to keep him in shape and healthy. He has no idea that he has this genetic disorder, and neither do any of his doctors, despite the fact that he sees them so often they're practically family. That's probably because XLA is a fairly rare disorder. It affects approximately 1 in 100,000 males, so it's not something that Ted or his doctors have been looking out for. But now, at 23 years old, Ted is sick and tired of being sick and tired. He's already by far run out of sick days at work, and so often when he shows up at the office, he looks like an advertisement for the zombie apocalypse. He's more often than not avoided by his coworkers, but can you blame them? Sometimes he coughs so frequently and so violently that it's difficult not to fear the air that he breathes. Not to mention the fact that his scars from childhood chickenpox make his arms look like sick meat. And so, Ted has resolved this New Year's to make 2014 a healthy year. He's scheduled an appointment with his doctor, but this time not just to address one of his oh-so-common respiratory infections. He wants to get fixed up for good. He goes to the doctor and does intense testing for just over 3 hours. After waiting for a couple weeks, he receives his results in the mail and finds out nothing. The results have figured out nothing, besides the fact that his antibody count is lower than usual. The medical bill, of course, is high, just as always, and it puts him farther in debt. And this doesn't help at all the fact that he's getting closer and closer to eviction. Now, a large part of Ted's inability to be successfully diagnosed is the rarity of XLA, and therefore the low awareness of it among the medical field. If his doctor had known more about XLA, he would have recommended a Western blot test to Ted, which would have confirmed the BTK mutation and diagnosed him with this disorder. But the rarity and high cost of this test prohibits its use in normal screenings, and genetic counselors often even advise patients to skip this test. If he had recognized the XLA in his patient, he would have treated him with an intravenous infusion of immunoglobulin every 3 to 4 weeks. But, seeing as he had never experienced any patients with this disease, he had no idea what he was saying. And so Ted, after living for 20 more years in ignorance, he finally caught a respiratory infection more severe than he had ever experienced. And, well, you know the rest. Ted was 1 in 100,000 males to have been born with X-linked agammaglobulinemia. This ratio makes it rare enough to go unrecognized by patients and doctors, but 1 in 100,000 is common enough to make a difference.